If you have had breast cancer surgery, chances are you have felt at least some level of stiffness or tightness. So the question is, should you be stretching? How do you know if you should be stretching? If you do need to stretch, what stretches do you do? How long do you hold them? How many repetitions you should be doing? And how long after surgery, days, weeks, or months, should you continue to stretch? And how do you know when it's okay to stop? I'm cancer physical therapy specialist, Dr. Leslie Waltke. Those questions answered and more today in the recovery room. There are 4 primary stretches that I want you to check once you get done watching these videos. The 4 motions are, number 1, the overhead stretch. Number 2, the butterfly stretch. 3, the snow angel, or if you're in the southern hemisphere, it's called the sand angel. And then number 4, the lower trunk rotation stretch. I'm going to introduce you to my former patient, Susan, who is a breast cancer survivor, who has very generously offered her time to demonstrate these stretches for us. Let's meet Susan and let's dive in. I want to begin by demonstrating what you should be able to do. Lying on your back, with both hands overhead and elbows straight, you should be able to lower both arms over your head and nearly touch the floor. Secondly, with elbows bent and hands behind your head, you should be able to lower both elbows down and out to the side, and again, nearly get all the way to the floor. 3, arms at your sides, elbows straight, palms up. You should be able to slide both arms out to the side, keeping them flat on the floor of the table till they reach all the way up to your head. And then finally, rotating your knees to the opposite side of your surgery, you should then be able to slide your surgical arm out to the side, keeping it flat on the floor on the table, all the way up over your head. Now, to answer the question, do you need to be stretching? The answer is going to come from those 4 motions. If you were able to get through all those motions without any stiffness or tightness and are able to get your arms all the way through the motion, then you don't need to be stretching. If, however, one or more of them felt stiff or tight, or you couldn't complete the full range of motion, then you do need to spend time on that particular stretch or those particular stretches. Now, if you are brand new post-operative within the last couple of weeks, you can hold those stretches about 5 seconds or so. If you are months out, then maybe hold them for 15 to 20 seconds. And if you are years out, then I would probably hold those stretches for about 30 seconds. I would spend anywhere from 3 to 10 repetitions on each stretch, depending on how tight it feels. When you get done stretching, you should either feel the same or you should feel a lot better. That's how you know you're getting a good amount of stretching. Now, how long do you need to continue stretching? I would continue stretching until that motion or that mobility feels pretty normal. Now, that can take up to 12 weeks. And you're going to probably need to keep stretching for about a year to a year and a half after the conclusion of the surgery or after the conclusion of the radiation. It takes a good year to a year and a half for that scar tissue and that fibrosis and the tissue shrinking to happen and fully mature. But after a year and a half, that shrinking should stop. You're going to get yourself stretched out, and I promise you, if you stick with it, that tightness will go away. Now let's demonstrate the proper technique for each of those 4 stretches, beginning with the overhead stretch. Lying on your back, find something to hold on to in both hands. You're going to start with your hands directly over your shoulders, elbows straight. You're going to slowly lower both arms over your head until you feel a medium pull or stretch. You're going to stop there and hold for anywhere from 5 counts to 30 counts, depending on how far post-surgery you are. Secondly, with the butterfly stretch, you're going to clasp both hands behind your head, start with your elbows up, and then slowly lower both elbows down and out to the side, again until you feel a good medium pull or stretch in your surgical side. Hold again anywhere from 5 to 30 counts, and repeat anywhere from 3 to 10 times. With the snow angel stretch, you're going to start with your arms at your sides, palms up, elbows straight. You're going to slide them out to the side, keeping them flat on the floor or the table or the bed until you feel a good medium stretch. Hold there again for 5 to 30 counts. And then finally, with a trunk rotation stretch, you're going to rotate your knees opposite of the side that you want to stretch. The arm is going to be, again, elbow straight, palm up. You're going to slide it out to the side. Again, till you feel a medium pull or stretch. Hold there for 5 to 30 counts. Again, repeating anywhere from 3 to 10 times. Thank you for taking the time to stretch with me. Because if you are uncomfortable, stiff or tight, if you stretch, you will feel a ton better, I promise. If you have difficulty, contact your local oncology physical therapist for help. I'm Dr. Leslie Waltke, signing out from the recovery room. Stretch well. We'll talk again soon.